Good morning or good afternoon, dear colleagues and friends, including the friends online. Welcome to the 90th Global Health History Seminar. Today's subject is climate change and health. The Global Health History Seminar series was established in late 2004 and co-hosted in Geneva and elsewhere by the World Health Organization and the University of York, where our collaborating Center for Global Health Histories is located. It is supported also by the Wellcome Trust Foundation. Seminars take place once every month and are broadcast via the internet. I'm honored to introduce my co-chair, Professor Sanjoy Bhattacharya, Director of WHO Collaborating Center at the University of York, and our two speakers today, Professor Merrill Singer from the University of Connecticut, and Dr. Diarmid, Campbell-Lendrum, Scientist of Evidence and Policy on Environmental Health at the World Health Organization. Second gentleman over there. Each of the two presentations will last about 25 minutes, followed by question and answer session for both speakers. This session will be chaired by Sanjoy. Kindly remind everyone to speak into the microphone and give your name since the presentation and the whole event is broadcast. The first speaker is Professor Merrill Singer. Merrill is a medical and cultural anthropologist. He's a professor in the Department of Anthropology and Community Medicine and a senior research scientist at Center for Health Intervention and Prevention at the University of Connecticut. The central issue in his work is the social origins of health inequity. Over his career, his research and writing have addressed HIV/AIDS in highly vulnerable and disadvantaged populations, illicit drug use and drinking behavior, community and structural violence, and the political ecology of health, including the health consequences of climate change. His current research focuses on community health impacts of climate change and epidemics of fear. Dr. Singer has published over 275 articles and book chapters and has authored or edited 29 books. He is a recipient of the Rudolph Virtual Professional Prize, the George Foster Memorial Award for Practicing Anthropology, the AIDS and Anthropology Paper Prize, the Prize for Distinguished Achievement in a Critical Study of North America, the Solon T. Campbell Award for Public and Applied Anthropology from the American Anthropological Association, and the AIDS and Anthropology Research Group's Distinguished Service Award. Mario, the floor is yours, please.
Thank you very much, Jane. And thanks, Sanjoy, and you for coming. It's nice to be here. And if anybody in Connecticut is up at 7 a.m. to watch this, hello to you as well. Our world is changing in dramatic and consequential ways, from the melting glaciers to rising seas and from increases in violent storms to emergent and spreading diseases, and from more damaging heat waves to increasingly intense wildfires. Many of these changes reflect, in fact, all of these changes reflect a pattern of anthropogenic planetary warming. These entwined climatic and environmental changes are having direct impact on human health around the globe. Not equally so, but not without some kinds of adverse effects everywhere. Consequently, the 2015 Lancet Commission on Health and Climate Change concluded that the implications of climate change for the global population threatens to undermine the last half-century of gains in development and global health. Indeed, climate change has been called the greatest threat to human health in the 21st century, and it's potentially the worst global threat to human health ever encountered. Climate change is estimated to already be causing 300,000 deaths annually around the world, affecting 300 million people, according to a study by the Global Humanitarian Forum, a think tank organized by the former UN Secretary General. The study, which refers to climate change as the silent killer, projects that it will cause as many as 500,000 deaths by the year 2030, and is the greatest humanitarian threat the world faces. In this presentation, I begin and end by exploring the anthropology of climate change. Historically, I addressed the archaeology, number one, of natural climate change in human history and its effects on human health, to get an understanding of just how dramatic climate can impact human health and society and the direction of human societies. Second, I discussed the diseases of climate change, or a partial list, because the full list would take us quite a lot longer than we have. And then I returned to contemporary anthropogenic climate change and what my discipline, anthropology, is trying to do there in that field to provide a historic anthropological perspective on climate change and health. Without question, the Earth's climate has never been static. If you go back 65 million years in time, the age of dinosaurs, the whole planet was tropical. There were palm trees growing in Antarctic. Crocodiles dwelled in north of Greenland. Moreover, we know that climate has always been a factor in shaping human life on Earth, and this effect began long before humans were having much influence on climate patterns. Archaeologists have used their excavation findings from past societies to assess the historic pattern of social responses to early natural climate changes in local and regional sites, changes that were caused by natural forces like volcanic eruptions, modulations of the tilt of the Earth, shifts in ocean circulation, and solar variation. This work on naturally triggered climate change shows that societal transformations often coincide with climatic alterations, although the shifts in climate systems do not always result in significant changes in society. One of the notable impacts of climate change through history was the pattern that developed in the peopling of the world, as changes in climate both facilitated and restrained human geographic movement at various points in time and in different locations. Brian Fagan, an archaeologist, observes that humans have experienced constant and dramatic swings in global climate over the last 730,000 years, a period that has included at least 9 glacial episodes interspersed with warm interglacial periods. Fagan maintains that the last glacial episode, which lasted from 118,000 to 15,000 years ago, was merely the most recent in a pattern of chilling and warming that continues to this day. However, it was during this prolonged cold episode that Homo sapiens left tropical Africa and colonized Europe, Asia, and finally the Americas, as well as Australia. Additionally, climate has played a role in the collapse of social systems and contributed to the limited human use and then rejuvenation of physical environments, allowing subsequent reoccupation. For example, the period from 5 to 3,000 years before present appears to have been characterized by particularly unstable climatic events in many parts of the world. Around 4,000 years ago, urban civilizations in Mesopotamia, Egypt, and India collapsed as a result in no small part of climate change. Social change of this magnitude inevitably reflect significant disruptions to human health and well-being. Studies of the impacts of significant climate change on past human societies suggest that a range of adverse responses have occurred in human communities, including epidemics, dietary disruptions, increased conflict and war, and societal depopulations. Based on recent research on these issues in ancient China, David Zhang and colleagues note, when the speed of human innovation and its transfer were not fast enough to keep pace with rapid ecological change, famine and disease became difficult to avoid, war and population decline became common consequences of climate-induced ecological stress in the prehistoric era. In 2011, researcher Andrew Curry published a study using dendrochronology, or tree ring analysis, to examine the relationship of climate events in early Europe. According to this research, the rise and expansion of the Roman Empire between 2300 and 1800 years ago was characterized by mild, warm summers and wet weather, two things essential for large-scale agriculture. However, the data also show that climate and disaster coincide as well. External invasions, internal political turmoil, and of concern here, drought all appear to have contributed to the fall of the Roman Empire. At the same time, wet summers matched the timing of the Black Death, which killed nearly half of Europe in 1347, and human conditions tend to help disease spread. These researchers insist that bad weather is far from the only factor that contributes to catastrophes, but there is simply no doubt that climate change has played an important and at times dramatic role in the societal evolution of our species. While archaeologists, historians, and others are still examining the details, a pattern is emerging suggesting significant climate impacts through time on human societies and human health. As the technological capacity that comprises part of human cultural systems has increased, including especially our ability to extract and use more powerful sources of energy, societies have increased their ability to adapt socially to climate change. However, in the contemporary moment and into the future, the question is raised, do we have the capacity to adapt to accelerated mounting climate changes that are not natural, but a product of our own activities? It is, of course, the modern era of anthropogenic climate change, especially since the Industrial Revolution, that is of primary concern, as it is reshaping health worldwide right now and into the future. In 2012, WHO and the World Meteorological Organization issued a report entitled Atlas of Health and Climate, which said that there are a panoply of health issues produced by climate change, which occur through various exposure pathways. Many health problems of climate change are not well understood and are not fully recognized even in the Atlas. However, the report does emphasize at least 5 key points. 1, human health is already being profoundly affected by weather and climate. Existing studies suggest that climate change could expose an additional 2 billion people to the debilitating and potentially lethal vector-borne disease dengue by 2080, for example. 2, extreme weather events are killing tens of thousands of people every year and undermining the physical and psychological health of millions. 3, droughts are directly affecting nutrition and the incidence of diseases, including infectious diseases. 4, floods and cyclones are triggering outbreaks of infectious diseases and damaging hospitals and other health infrastructure, overwhelming health services just as they are needed most. 5, long-term climate change threatens to exacerbate today's global health problems while undermining tomorrow's health systems, infrastructure, social protection systems, and supplies of food and water and other ecosystem products and services needed for maintaining human health. In fact, many of the major diseases and other killers of humans are highly climate dependent, highly climate sensitive, and will likely worsen as the climate warms. Although many disease effects of climate change have been identified and described, the full global disease burden for only a limited number of climate-sensitive diseases has thus far been quantified. Nonetheless, it is now clear that I'm missing a slide. First, globally, the number of reported weather-related natural diseases has tripled since 1960. For example, Webster and colleagues examined the number of tropical cyclones and cyclone days, as well as tropical cyclone intensity during a 35-year period, 1970 to 2005. In environments of increasing sea surface temperature, they found a substantial increase in the number and proportion of hurricanes reaching Category 4 and 5, the largest increase in the Northern Pacific, Indian, and Pacific Oceans, which is consistent with climate model simulations and suggests that a doubling of CO2 may increase the frequency and hence adverse human impacts of most intense cyclones. Second, extreme high air temperatures contribute directly to deaths from cardiovascular and respiratory diseases, particularly among senior citizens. High temperatures also raise the levels of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory diseases. Heat waves linked to climate change are affecting the incidence of hospital admissions for chest pain, acute coronary syndrome, stroke, and variations in cardiac dysrhythmias. Extreme heat exposure is a stressor in individuals with pre-existing cardiovascular diseases. Third, climate change can and has made some environments more hospitable for disease-bearing vectors like mosquitoes. Currently, infectious diseases cause about 37% of all deaths in the world, a percentage that may rise as the planet warms and vectors move to new areas and become more mobile, more active, produce more rapidly under warmer conditions. 5, there's a growing risk from fungal diseases. Abundant worldwide, about 70,000 fungus species have been identified, but it is assumed that there are far more that we don't even know. In recent years, the threat of fungus species to health has been spurred by the food crisis. Many fungal species produce bioactive compounds called mycotoxins that are poisonous to animals and people. 6, pollen and other allergen levels are also higher in extreme heat. These can trigger asthma, which affects millions of people. Ongoing rises in temperature are expected to increase this health burden. Finally, rising temperatures are linked to increases in frequency, duration, and severity of heat waves and their health effects. Heat waves can have enormous impacts on human health, with heat-related mortality occasionally more than doubling during heat waves. Rates of heat wave related illness and death may be particularly severe among urban populations because of heat island effects produced by the concentration of large buildings that absorb heat and elevate urban temperatures several degrees above surrounding less developed areas. Some social locations within urban areas, such as inner city areas, may exhibit special vulnerability to the effects of rising temperature for a number of reasons. One, the housing stocks are poorer, less protective of populations. There's greater density of populations, including the doubling up of families in single units, income disparities that limit access to protective resources like air conditioning, elevated prevalence of pre-existing and chronic diseases, asthma, diabetes, etc., concentrations of vulnerable age groups, seniors, children under 1 year of age, and limited access to health care and adaptive health information. As a result, among poor minority populations in urban areas, dramatic increases in annual heat-related deaths as high as 7 times the level seen during the 1990s have been forecast for the middle of the current century. Importantly, climate change is not occurring in a world free of heavy health burdens, especially in poor and middle-income countries, but also in the poor sectors of wealthy countries. Climate change acts as a stress magnifier for many existing public health problems. Given the unequal burden of disease in the world, there's little doubt that poor populations are most vulnerable overall to health effects of climate change, even though they are not the ones that produce climate warming. Moreover, the more severe and rapid climate change, the more disruptive to societies and the more burdensome to human health. In light of these factors, that climate change is a product of human decisions and activities, climate change interacts adversely with other anthropogenic environmental disruptions and degradations. The diseases of climate change add to and exacerbate existing health burdens in the world, and that much climate change, environmental pollution, and the global disease burden are directly linked to patterns of social and economic inequality and their impacts on human life. So the question is raised, what can a discipline like anthropology that studies the human condition add to our understanding of climate change? An anthropology of climate change has been building over the last 20 years, especially since 2009, and is now beginning to develop a sizable literature and related activities, actors, and actions. First, anthropologists increasingly have been active in documenting the special challenges, lived experiences, including perceived health effects, local knowledge, and perceptions of contemporary anthropogenic climate change in human communities around the world, but especially in developing settings that are hardest hit but least involved in the production of greenhouse gases. Here, anthropologists are assessing concepts like risk, vulnerability, and resilience, and examining the sustainability of local ways of life and resource utilization. Among medical anthropologists, a topic of concern, of course, is health implications of climate change, including its impacts on the spread of vectors and all of the other issues that I've mentioned so far. In my own research with a low-income Latino Hispanic population in the U.S., despite expressing various degrees of confusion about the precise nature of climate change and which environmental features and events have been linked scientifically to a warming planet, the individuals who comprise our sample readily communicate that they experience regular feelings of precarity and health vulnerability in a world of rising temperatures and related environmental disruptions, as has been found by many anthropologists now in a number of communities around the world. They tend to frame this view of the world in terms of increasing susceptibility over time, with growing consequence for their children and for themselves as they age. Concerns about children were particularly pronounced in the expressed climate change attitudes of study participants, intermingled with their upsetting sense of mounting uncertainty was a distinct feeling of powerlessness, as expressed by one participant, one's ability to protect oneself from the adverse effects of climate change diminish with age. These findings suggest that in addition to direct health effects of climate change, there is a second set of health effects: consternation, worry, and mounting sense of vulnerability and powerlessness. These are important issues to address in applied efforts in a time of climate change. Second, anthropologists have worked on identifying the range of factors that influence how and why communities react as they do to climate change, including initiating adaptive responses, politically organizing to demand dramatic cuts in global greenhouse gas emissions, seeking out assistance to adjust to growing threats of fleeing deteriorating conditions, and frustratingly expressing a lack of capacity to act meaningfully to changes that are occurring. All of these issues are outside of the domain of expertise of climate scientists and involve issues of culture and social structure. Third, there's been a growing anthropological involvement in assessing the social origins of climate change in light of growth of the global economic system's dependence on profit-making and unequal distribution of wealth, continual resource depletion, and mounting waste-producing economic expansion. This issue, too, is beyond climate scientists in that how human societies perceive and treat their environments, how they organize the use of energy, and the systematic drivers of massive quantities of greenhouse production and emission are embedded in social, not environmental systems. Fourth, anthropologists have begun to draw attention, suppose I should change, to the interaction of climate change with a substantial list of anthropogenic environmental transformations and ecological crises. Rather than a standalone threat, global warming is but one of multiple consequences of human restructuring of planetary ecosystems. Anthropologists are investigating these intersections in light of their capacity to multiply the deleterious impact of climate change on communities of long-standing anthropological interest. Fifth, anthropologists are studying the impacts of the science of climate change and organized climate change denial on popular understandings of global warming. How is climate science disseminated and received by global audiences, through which channels and with what effects? What aspects of climate science assessment are adopted and integrated with local knowledge under what conditions? Six, anthropologists are investigating the social origin and economic motivations of climate change denial and the social ideologies and motivations of climate change deniers. Given the success of the latter in sowing confusion about planetary warming and in delaying meaningful policy responses to pending crisis, gaining a clear understanding of climate change denial is of critical importance. Finally, anthropologists are working in applied initiatives that seek to respond to climate change at the local, regional, national, and global levels, reflecting understandings in application that have developed over the last half-century. Applied anthropologists are seeking ways to collaborate with communities to assist them in addressing their climate change concerns or bridging the science community divide mentioned above, including around health issues. Margaret Mead, who played a pioneering role in the anthropology of climate change, organizing one of the first conferences on the topic, wrote, "Never doubt that a small group of thoughtful, committed citizens can change the world. It's the only thing that ever has." So too, perhaps, a thoughtful, committed discipline. Thank you.
Thank you very much, Merrill. So our second speaker is Dr. Diarmid Campbell-Lendrum. Diarmid leads the climate change and health team in the Department of Public Health, Environmental and Social Determinants of Health at WHO headquarters. He has played key roles in the development of the first quantitative estimates of the overall health impacts of climate change, the 2008 World Health Assembly resolution, and the first global conference on health and climate. He also leads the implementation of WHO work plan on climate change, including a series of projects to pilot health adaptation in vulnerable countries. Diarmid is the author of multiple journal papers, reports, and book chapters on the ecology and control of infectious diseases, and on the health implications of global environmental change. He is a lead author of the recent Intergovernmental Panel on Climate Change, IPCC, special report on extreme events, and of the health chapter of the 5th assessment report of the IPCC. Diarmid, the floor is yours, please.
Thank you very much. It's really a pleasure to be invited to speak to this audience. I usually say thank you for inviting me to be here, but I work here. I mean, you can't keep me out, so I'm here all week. So what I'll be doing, in what I hope is a complement to the previous presentation, will be, I think, taking off from that very comprehensive long-term historical overview, showing that climate and climate change are intricately linked with human health and always have been. I'm very pleased that was covered in that presentation. I won't really be doing it in mine. And instead, talking much more about effectively the recent history of climate change and health, and particularly from a WHO point of view, the evolution of our approach to health and climate change, mainly over the last 20 or 30 years. So taking this reality that climate change really matters for human health and looking at the current political context of how that translates into the global discussions on climate change and into the overall approach that the health community and WHO has to this critical issue. But as this is a history lecture, I will go back somewhat in time, so about as far back as we can go, and I will try and do effectively 2,000 years of history in 4 slides. Well, in fact, what I will do is just to take one history slide as sort of an anchor point, to reinforce the point that I think has already been made in the previous presentation, that everybody who works on health throughout the history of health as a discipline has acknowledged or should have acknowledged that climate and weather play important roles in human health. And this is a quote from Hippocrates, sort of the father of at least the Western tradition of medicine, and in one of his early writings he was making absolutely clear that if you want to understand population health, then one of the things you need to look at is the weather conditions, the climate conditions. And you also have to look at the different context of those. So weather and climate are important, but it also depends where you are and how you're affected by those elements. So we have basically been using this quote for quite a long time now to make clear that this is not news. Climate change and health is not news. Even Hippocrates knew that. So to jump forward basically into the modern era, so since it has been appreciated, at least since the 1980s, that human activities are affecting the global climate, there has been the start of an international effort to address this, mainly through the big climate change discussions, the international conferences that we have on climate change. And the first of those was the first conference of the parties to the UN Framework Convention on Climate Change, so the international agreement which is supposed to address this issue, was in 1992 in Rio. That gave rise to the UN Framework Convention on Climate Change. And one of the other points that we make from the health point of view is that health has been central to that justification from the start. So from the start of people realizing that humans are affecting the global climate, coming together as an international community to do something about it, health has been a central part of that rationale. And our sort of evidence for this is that in the original UNFCCC document, basically the principles of that document, the aim of the whole treaty and all of the climate change industry, if you like, that has taken place since that time, is to avoid adverse effects of climate change. And if you look in the convention what is meant by the adverse effects of climate change, the definition is there. And human health is one of the three things that we're trying to avoid damage to. So we argue that human health is at least a third of the story of the effort to address climate change. I'll come back to this in a minute to see, we can look at how well that's been reflected so far, but it is central to the original justification. And going back to about the same time, from the WHO point of view, I think we can claim to have been quite early on this issue. That in fact, slightly before the UN Framework Convention on Climate Change, the same time as the first Intergovernmental Panel on Climate Change report was published in 1990, was also the year that WHO published its first report on the links between climate change and health. So we sometimes feel we've been a bit slow in engaging fully on this issue, but we have been accompanying it all of the way through. So, so that's the report on the left. And then throughout the 1990s, WHO, with a small amount of investment of time and people, started to document the links between health and climate change. And so on the right-hand side is the first WHO book on climate change and health, published in 1996. And at this point, I have to pay tribute to Tony McMichael, who is really the father of this area of research, a professor from Australia, then working in the UK, and really was I would say, the intellectual powerhouse behind documenting that climate change and the human impact of climate change is critical to human health. Unfortunately, passed away a year ago. A year ago this month. So we were starting to get involved with this. We were starting to describe the evidence that climate change impacts on health. But like much of the climate change discussion, this was not without its hiccups. And in some parts of the work on climate change and health, particularly in relation to vector-borne diseases, there is some of the controversy that we see, at least in the representation of climate change and health in the general media, also was reflected in some way in the links between climate change and health. So some of the early work started to come out suggesting that climate change was going to impact health, potentially quite negatively. It tended to get picked up quite strongly in the media. So there was a lot of coverage of studies that suggested that climate change may increase malaria risk in Europe and so on. This was massively amplified. And there was a certain amount of pushback and really quite hostile reaction from parts of the health community that were saying, well, you're overemphasizing the risk of climate change. Climate change is not the only determinant of these diseases. And in fact, there was a certain amount of polarization in the debate, particularly around vector-borne diseases, which, as I say, sort of reflected some of the wider discussions of climate change and health. So on the left, this is one of the early studies of climate change and its potential effects on malaria from the mid-1990s. And on the right-hand side is the reactions of some vector-borne disease specialists to this work, with rather intemperate reaction, basically suggesting these people don't know what they're talking about. They're not specialists in this field. And it is a challenge that we have in climate change, in that climate affects so many different diseases in so many diverse and often uncertain ways that it's often difficult to get the full, either good evidence or the full picture of those effects with the level of reductionism and detail that we're maybe used to in dealing with individual diseases. That's a tension that I think continues to a certain extent to this day. So in the same era, we had this gradual accumulation of evidence, and it was starting to become more and more accepted that climate change was going to affect health. And one of the, I would say the key bits of evidence, or the key studies that helped to underpin this, was that in about 2000, WHO included climate change in as one of the risk factors in its global burden of disease and risk assessment work. I was working at the London School at the time with Tony McMichael, and we were asked to estimate the global burden of disease from climate change, which seemed like a horrendous question to ask us. I remember telling a colleague of mine that we've been given this job of estimating the burden of disease from climate change. His reaction was, give it back to the dog. It was such a challenging and difficult thing to do. Yet it was clear that WHO did take this risk seriously, and they wanted to try and put it on the same evidence base as the other risk factors we were dealing with. So we came out with the most credible estimates we could of the health impacts of climate change in the year 2000, which in fact got a huge amount of media coverage. It was published in the World Health Report. We had a good evidence base behind it, but it really started to hit the headlines that WHO was saying that climate change was in fact already killing people and likely to carry on into the future. And in fact, I just found this last night as I was putting this presentation together. This is the launch of the report in 2003. So that's my colleague Bettina Mene on the left. I was also there in the middle. And Gregory Hartwell, who knows our communications person, obviously just as enthusiastic as I was to be in a room full of journalists trying to defend these estimates. Please rest assured that my look of arrogance there is in fact terror at being put in a room with a load of journalists. But the link between climate change and health was becoming more and more mainstream. Again, not without its controversies, but it was really moving into the mainstream. So that was the case up, and I would say that's the broad picture up until about 2006, 2007. And then we did start to have a real change in the scope and the level of importance that was put on climate change work from about 2007 onwards. And in fact, when our current Director General took office in 2007, one of the first major speeches that she gave was on the links between climate change and health. She did this in the US. And this is a quote from one of the speeches. It's also the origin of the quote that climate change may be the greatest public health threat of the current century. She said that in her speech, later picked up and amplified by the Lancet. So the DG has said this is important from basically the start of her tenure as Director General. 2008, climate change was selected as a theme for World Health Day, and very importantly for us, there was a resolution passed through the World Health Assembly with unanimous support from the member states that health was significantly at risk from climate change, and that WHO should strengthen its work in this issue. And I have to say that the level of support and interest from the countries surprised us. We thought it might be a hard sell to get countries to talk about climate change and health when they have all of these other problems. But in fact, with one notable country exception at the time, all of the countries were in fact very strong on the issue, and in fact were asking, where have you been on this issue? You should have engaged stronger earlier. So we had our resolution passed in 2008 and a work plan to back that, which has just been renewed at the last executive board. So that's sort of what was happening on the WHO side. And we're also starting to pick up the evidence that, in fact, although climate change is mainly discussed as an environmental issue, if you present people with the links between climate change and health, it actually has quite a strong resonance with the public. So this was a study that was carried out during the 2000s, published in UNDP's World Development Report in 2007, which was some polling data around 30 countries that just asked people in the streets, what are you concerned about from climate change? And they had health on the list. And when health was on the list, it actually came out as a top priority. So they're concerned about ecosystem disruption, they're concerned about flooding and so on. But if you point out that there are links between health and climate change, that is what in fact concerns people. So we're starting to see endorsement from our member states and also from the general public that this is something that really we do indeed need to work on. In addition to the evidence that we have, it's something that, that people identify with. And during this same period as well, after the signing of the UN Framework Convention on Climate Change in 1992, we then had the Kyoto Protocol in 1997, which is the first sort of legal instrument to get countries to reduce greenhouse gas emissions and so on. But in this period, we were building up to the climate change conference in Copenhagen, which was one of the conferences of the parties under the UNFCCC. So this was to take place in 2009. And at that time, there was basically a ramping up of rhetoric around climate change. that we had the evidence that it was extremely damaging. We had the evidence that it was humans that were causing climate change. And we had, for example, Al Gore's movie, An Inconvenient Truth, came out in, I think, 2005 to 2006. You had covers such as this Time magazine cover. You had the front cover of The Lancet. All of these basically ramping up the rhetoric to say we have to do the climate deal in Copenhagen, otherwise the planet is doomed. And so that was sort of what was going on the environmental side. And at the same time, we were trying to point out that if you're going to talk about climate change, and bearing in mind that health was central to the original convention, then health ought to be reflected in this agreement as well. So this is a slide I've been using for a while, which is basically a measure of how well health was reflected in the discussions on the climate change agreement. So I'll let you read the questions and guess the answer. There is a single answer to all of these questions. And the answer is 1. So in this huge draft that we have for Copenhagen, there was one mention of health. A whole load of side events. One of them was on health, that was our one. The economic models that were supposedly telling people how much they should spend on addressing climate change, only one of those took any account of health, the health benefits you would get, and so on. So we're starting to see some interest in the health implications of climate change, but for the most part, health remained sidelined. It was mainly an environment and a development and economic debate. So this is in the run-up to Copenhagen. And then most of you probably know what happened in Copenhagen. The attempt to reach one all-encompassing globally binding deal essentially failed. So when the pressure was ramped up and there were various failings in the run-up, when that deal was trying to be put on the table, basically the main parties backed away from it. So there was an agreement that came out of Copenhagen. It didn't achieve nothing. There were commitments that came out of Copenhagen, but it didn't come up with the solid, legally binding agreement that I think everybody wanted to get out of that deal. So this is basically the conclusion that we've turned out we're not going to solve this in one go. And as we now, after having basically taken this big setback in Copenhagen, most of the last 6 years on the climate change negotiation side have been warming up, trying to do the preparations to, again, get the best deal possible at the equivalent climate change conference in Paris in December. So this is basically my slide, a summary of the main events that have happened both on the environmental side and on the health side. So this is the actual temperature graph over basically the period I've been talking about. So obviously not doing very well in getting global temperatures down, but we have been doing a lot in terms of negotiations and so on. So if we go back to the early 1990s, the establishment of the Intergovernmental Panel on Climate Change, UNFCCC in Rio, the Kyoto Protocol, and so on, all of the things that I've described are basically, I would say, the main events that have been happening on the environmental negotiation side. And from the health side, of course, it's not at the same level, but I would say that there has been a parallel process of evolution of the development of work on health and climate change, coming out with reports, engaging in the negotiations and so on. So we haven't been sitting back from the health side and just letting the environment and development people take all of it. So basically this brings us up now into sort of the modern era from our point of view. So the period between Copenhagen and also the signing of our resolution and so on, up until 2015 and what we're trying to do in preparation for the Paris COP. So as we came out of Copenhagen, we were already thinking we have to try and change the way in which we approach this issue. So it obviously isn't enough just to try and scare people that climate change is going to have impacts on health. You're all very worried, so therefore, we need to sign a big deal and we need loads of money to do what we need to do. It's obviously more complicated than that, and it relates much more to human behavior and their perceptions of the issue, also what you can do with economic systems and so on. So rather than the face of climate change just being a polar bear, just being it being about the natural environment, we have been trying since that time to basically an approach which is promotion approach, which from our point of view is more about centered in public health, less centered in the environment itself, more diverse in terms of dealing with not only with the health risks of climate change, but the health benefits that you can get by building resilience and also by gaining health benefits from reducing greenhouse gas emissions, focusing much more on what you can practically do to protect people's health from climate change, and also a much more positive vision of how we can improve health as we address this huge challenge. And I'll just run through a series of things that I think of as quite positive signals in terms of the way we're approaching health and climate change. This is not to undermine the scale of the challenge. It remains a huge challenge. The effort to cut greenhouse gas emissions remains one of the most, if not the most difficult struggle that we have, I would say, as a global society. But I'm sort of picking up on the things that I think we can build on. One is that the evidence base on the links between health and climate change is rapidly growing. So this slide is a survey that we did a couple of years ago, which basically looked at published papers on health and climate change as opposed to other disciplines, and basically showing that it is one of the largest growth areas in health publishing, basically, in the peer-reviewed literature. So it's not an absolute scale. So in fact, the absolute numbers of papers on air pollution, tobacco, obesity, and so on is much higher, but the relative increase is much greater for health and climate change. So we're getting a lot more evidence. The second is that we're doing a lot more now on actually implementing adaptation to climate change or building health resilience to climate change. So on this slide, all of those stars are health adaptation projects that I think we're involved with. All of them bar one are ours, basically, or ours in partnership with others, each of them with $500,000 or more. Each of them started since about 2009. And so over this recent period, we're actually gaining practical experience in supporting health programs in countries to build their resilience to climate change. And that's everything from carrying out risk assessments to improving disease surveillance, using climate information for disease surveillance, capacity building, and so on. So we're actually getting involved in the practical application. Another, which is a really important thing for us, is that since about that same time, 2008, 2009, we've been talking about the health benefits that you can gain as you cut greenhouse gas emissions. So it's not just a case of taking climate change as a threat to health and working through health systems to protect from risks. It's pointing out that the things that we need to do to cut greenhouse gas emissions, many of them, if we do them right, could bring huge public health benefits. And a couple of those examples are shown on this slide. And I have to say, it's taken a little while to get sort of acceptance that this is appropriate ground for the health community or for WHO to work on. The initial feedback we were getting was, we'll just talk about diseases, talk about the threats of natural disasters, because that's core health business. It's a little bit more of a hurdle for us to be able to say, well, actually, we want to talk about the health implications of transport policy or the health implications of energy policy. But the evidence is that certain decisions that are taken in those sectors are not only critical to cutting greenhouse gas emissions, but could have huge implications for public health. And this is one of the phrases that we and others have started to use about addressing climate change as a huge public health opportunity, as well as avoiding a risk. And just one example of that, and I think this was alluded to in the earlier talk as well. The links between climate change and health are so diverse, and they connect to so many other parts of human activity that you have to talk about economics. You have to talk about human behavior if you're really going to grapple with this problem. And the good news from the health point of view is that health actually has some of the strongest arguments, some of the best evidence, and some of the biggest numbers in order to influence this policy, so many of these policies. So this probably looks a little bit obscure at the moment. I was quite struck by a paper that came out from the International Monetary Fund, one last year and one this year, which was looking at global energy subsidies. And so there's headlines in the newspapers saying IMF says that global energy consumption receives $5.3 trillion a year in subsidies, and pointing out that is more than global spending on health by all of the world's governments put together. If you look at this report, what they actually say is a subsidy. Only a small part of that is actually a financial subsidy. Most of what they're calling a subsidy is the fact that the health impacts of these energy decisions are not paid by anybody. They're uncompensated. So there's the fact that polluting energy, air pollution now, outdoor air pollution now kills over 3 million people every year. That is not factored into the price of the fuels that are causing that pollution. And they're saying that is a subsidy to the energy industry, and that price those health impacts should be included in the price of coal or the price of oil and so on. Not to penalize them, but as they would say, just to get them to pay the proper price for those consumptions. So this is basically the IMF's estimates of subsidies to all of these different fuel types. And if you look at what they're classing as subsidies, half of it basically is health, is uncosted health damages. And so we're making the case that if you are leaving health out of your energy pricing decisions, you're missing about half of the story. I think we're only in the first stages of coming to grips with this information, but it very much, I think, reinforces our point that health needs to be critical in all policies, including climate change mitigation policies, energy policies, and so on. The other good part of the story for us is that it's actually a very positive argument for health and for the environment. So the rest of the IMF study says that if countries basically put a price on carbon, which is in their own national interests, irrespective of fixing the global climate, if they just do what's best for their populations, then that would increase the price of polluting fuels, it would decrease the price of cleaner fuels. And the upshot of this, as they estimate, would be the tax would raise you about 3% of global GDP, and the impact on health would be to cut air pollution deaths in half, and the impact on climate change would be to reduce CO2 emissions by about 20%, simply by the fact of including these other impacts, particularly the health impacts, in the price of the fuels. And again, we're just starting to grapple with this to understand, whether we really endorse this or not, or what are the what is the health angle here. But it's clear there is a huge health angle that should be taken into account in all of these decisions. And then the final one is that we're not the only ones saying this anymore. That some key players, such as the IMF and others, are now starting to emphasize the health implications of climate change. The best example we have of that is that when President Obama launched the US's national plan on climate change earlier this year, he didn't do it from the White House, he did it from the asthma ward of a children's hospital. And the headlines were not about saving the planet, they were about cleaner air for our children and also jobs. And so certain key players are basically appreciating the same kinds of arguments we've been trying to make for a long time, that when you're trying to address climate change, you can't divorce it from other aspects of life. That's sort of where we went wrong the first time, saying you have to pay a load of money, but you'll save the planet. People are much more concerned about the direct implications for their everyday life. And administrations such as the US administration are now starting to present it in the same way. We'll have to see how well it works, but from our point of view, I think it's a positive way to go. So this is the final slide. That I think one of the most important things we have in our favor in talking about the links between health and climate change is that we do have evidence, we do have numbers and so on, but health is also a critical part of a positive vision of addressing climate change. So it's not all just about the dry economics or decreasing half a degree temperature and so on. It's about a vision of a cleaner, healthier society. So this is a slide we started using around the time of the Copenhagen conference. So basically saying that for example, if you transform your cities in this way, that it actually makes it possible, safe and easy to walk, cycle or take the bus. There's actually very good evidence for each of these health implications. The only thing we missed out is that we're still looking for a photograph where these people are actually wearing cycle helmets. But this is basically the final message that I wanted to get across. So we've been working on health and climate change for a long time. I think that we're certainly doing a lot more than we used to. It's moved absolutely mainstream in the climate change has moved mainstream in the health discussions, and to a certain extent, it's started to be taken up by the climate change discussions. But we can carry on presenting evidence, we can carry on doing our projects, but most of all, it's about presenting a more positive vision for a cleaner and healthier future. Thank you.
Thank you, Diarmid. Probably in the future, we will see much less cars around WHO building. It's true that the climate change has huge impact on health, and there's increasing awareness on environmental health. However, there's still a long way to go ahead of us. Now is the time for questions and answers. So, Sandra, please.
Hi, so I'm Sanjay Bhattacharya from the University of York. If I could just remind you all again, when you make comments, when you ask questions, could you please speak into the mic and identify yourself, because we have colleagues online who'd like to know your names and then, connect your name to the comments you make. As someone who's been working with Jing and her colleagues on global health histories for a very long time, as Diarmid pointed out, in 2010 we had another GHS seminar where the executive director of the Antarctic Research Center at the University of Cambridge came over. And what strikes me about that 2010 event and this event is there was an attempt to create greater understandings between the views that climate change has a health impact, whereas here today we've moved quite far where there is, I think, agreement now that there is a very serious health impact, and that we need strategies, unified intersectoral strategies, to try and increase information and evidence about how best to cope with the political and social challenges that can make a difference. So Merrill, I'd like to start off by asking about methodology. I was excited about this view that you are going to study, you and your team are going to study climate change denialism. How does an anthropologist study that and then work with people in policy to convince them of the usefulness of this academic research? Because it's the translation into policy or impact on policy that I think a lot of universities find challenging, because you will always, find oppositional figures within every organization or government agency. And Diarmid, I had a question about the national governments here. Again, in national governments, you see this binary sort of relationship between those who are looking at climate change from an environmental perspective and then people who are looking at sort of health. So, how do you work from within the WHO with national governments to create closer links between the two parties? If you could turn on the...
It's not actually my team that's at the moment, although I would like to be actually involved in the study of climate change denial, but there are other anthropologists who are. And, some of that is of course, looking at what are the sources of the message, climate change denial message, what are the messages, how are those messages communicated, what is the intention of those messages. All of that social, relational, social structural factors that are critical to understand, and how those get translated into everything, including last night's Republican presidential debate in the U.S., for example, where climate change got talked about, and you can actually track how that issue has changed over time in the articulation of it as a political issue in the United States and every other country. So trying to understand what's happening there and its effect on people. One of the things we looked at in our study, the one that I mentioned, was other studies have shown that people are often very confused about their environment and environmental threats to their health, anthropogenic environment threats to their health. There's this notion of environmental confusion. Is it the corporations polluting? Is it the neighbors who don't take care of their, lawns? Or throw trash in the alley or whatever. There's this concept of environmental confusion. So one of the things we wanted to look at is, are people in our study being impacted by the general message of climate change denial that's available in many places, many pronouncements from senators and congressmen in the U.S. About how climate change is a hoax and it's a left-wing plot and it's intended to bring down the American economy, a lot of things like that. It was noticeable how unimpacted the population we were studying, which is low-income Latinos, by this information. So they weren't receiving that message at all. They were receiving the message partly from the media, but partly from their own experience that something was amiss. And they didn't really quite understand it. They confused ozone and climate change, and they didn't have any completely clear and certainly not any uniform understanding. But clearly, they had developed an understanding and a concern. And so understanding those processes is something we're concerned about, so as to think about, as you work with community-based organizations, non-governmental organizations, how can you strengthen people's awareness, concern, their demand to be at the table where planning around adaptation is taking place. One of our questions was, have you been contacted by anyone in the city public health system about talking about climate change, its impacts on your health, planning for the future? And the answer was consistently no, 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 no. And yet, if you talk to the city health officials, some of whom are been long-term friends of mine in the city where this was done, they think they're doing it, and they're not. So there's a lot of issues there, and the point of our work and the work of many anthropologists is just to start there at the ground level and understand what's actually happening as a way to think about how do you change social systems from the ground up in part and from above down.
Yes, to take your question about how it works in terms of our work with government, it's a real challenge for us because climate change basically requires an intersectoral response. And most of the climate change mechanisms, the negotiations, the financial and technical support, mainly connects in most governments with the environment ministry. It's the usual point of contact, sometimes with certain infrastructure ministries and so on. And then from the health side, we talk to people through the World Health Assembly and so on, and yet they are not necessarily well connected in country. As a professor of mine used to say, intersectoral work is blessed by everybody, funded by nobody. So the incentives are not necessarily there to work together. And so we end up in this situation, for example, that everybody says health is important to climate change. It comes through in the convention. When countries assess their vulnerabilities, they say, yes, health is one of our top priorities. And yet when we look at the way that climate change financing has flowed for adaptation, it's somewhere in the region of 1%, maybe 1.5% of the money has gone to health projects. And yet when you complain about that to the climate change finance people, they say, we've never turned down a health project. It's just that your health people are not connected to the system and well enough briefed and supported to be able to access that money. And so a large part of what we do is working with the health ministries in countries to understand the processes. So there are national adaptation planning processes that are driven more from the environment side, supported by the UN Framework Convention on Climate Change. So we both tell them about those, give them the health guidance on writing the health component of a national adaptation plan, and that puts them then in a position to access that financing and get financial and technical support. One very, very quick point on that is that when we do that, they're in fact very well placed because health is a reasonably well organized, well-structured system where we do have procedures for doing things. We have health system strengthening, we have health system building blocks. So it's reasonably easy for us to develop a well-structured plan in a way that may be harder for agricultural coastal zones. We just have to do the work to support them, to put them in that position.
I want to make just one quick comment in response to what you said about how things have changed since the last one of these seminars that did address climate change, which you probably noticed. We don't know each other. We've never met before. We come from different disciplines. We live in different countries, etc. But you probably noticed we said a lot different aspects of the same things, and there were a lot of points of overlap, although we focused on different issues. There was no contradictions between the things we had to say, and that what's happened in that period of time is that a world of climate scientists on the one hand and a world of health people and a world of social scientists have all slowly come to this understanding of consensus, which from the perspective of climate change deniers is a conspiracy. So actually we met and conspired to tell you the lies that we told you today. And in exchange for the enormous grants that we get from the lies that we tell. And that's really the line that is often presented. But of course, none of that's true. It's just that that's where the knowledge has gone, and we both read the same things independently and participate in things and learn things, etc. And that struggle between what the whole range of climate, health, social scientists know now and the policy is painful. That it's so wide between knowledge and action.
I mean, before I throw the question and answer session open to the floor, I mean, Diarmid, I should point out that yesterday, sitting in Heathrow and LA, and I came across a new Wellcome Trust announcement of a major £75 million scheme to fund intersectoral research and advocacy and public engagement into environment and health, where climate change is an important thing. You should probably look at the announcement and link up with your academic colleagues in low and middle income countries. But anyway, so questions, comments? Sir.
Yeah, thank you very much. My name is Melek Hayesi. I come from NBI, or working on road safety. I think the intersectoral discussion is good because it actually shows that we can work together and we need to explore certain areas. And I like your final diagram. We shouldn't be able to give you someone putting on a helmet because you work on road safety, to actually just show that as we tackle climate change, greenhouse gas emissions, we need to be thinking of safety. But the second bit still I would like to emphasize is that when we think of intersectoral work, there are certain sectors that are really contributing significantly to the problem. I just think of the transport sector. When you look at the greenhouse gas emissions, about 13% of the global greenhouse gases are coming from transport, and 23% of the carbon dioxide is from transport. And so why can't we go for this animal in terms of the funds we are talking about and policy that is contributing significantly to the pollution, and then we add to it other sectors. I'm not saying we ignore one, but this has been, it's almost difficult to tame this animal since 1980s when this was highlighted. So it could be one of the sectors we could actually coalesce around and say, how do we sort out, organize this sector? Consider transport is so crucial, but the level of pollution, greenhouse gas pollution coming from this is very high.
Thanks very much for that input. I think I would just say we agree with you absolutely. As I think I made clear, it's taken us a while to basically get permission support to talk about looking at policies in other sectors that affect greenhouse gas emissions. Since at least 2008, 2009, we've been starting to talk about that. And you're right, if you look at the main greenhouse gas emitting sectors, you have energy production, electricity production, household energy, food and agriculture, transport, all of which are in the same order of magnitude. And for each of those, you can document actions that we could take which would both reduce greenhouse gas emissions and would improve health. And transport, you're sitting next to Elaine, she's been documenting that from the transport sector and from other sectors. I think we're at the stage where we've said that, and now we need to work with you and with others in terms of what are the actual policy levers by which we can do something about that. I think we're further advanced in terms of programs on the adaptation and resilience side, where we're talking about surveillance and water and sanitation, climate resilient water and sanitation and so on. On the mitigation, co-benefits and mitigation side, we've documented the evidence, but I think we would like to be talk very seriously with you and with others about, okay, what could we actually do through the transport sector in order to achieve those goals? Because there's certainly sort of political interest and support and potentially funding through the climate financing mechanisms. It takes us a while to work that out.
Since we're talking about transport, I can't resist to say something. It just strikes me that we still, before we get to advocacy even, we still lack some of the key quantifiers that would be really helpful to make the case. And then, since Maliki mentioned the traffic injury, our World Traffic Injury Report reports deaths and mortality by number of wheels on a vehicle. So you have absolutely no sense of deaths by mode. I think there is some breakdown for pedestrians. And this blurs completely the fact that usually public transport is safer, although in some countries it can also be more dangerous because it's not well regulated. So the whole issue of modal choice, which is so critical to the whole climate debate, is completely obscured in our very routine way of doing traffic injury reporting. And I think that's true. That runs throughout many of the mechanisms that we use for quantifying these types of issues. And the same thing of cost benefit for transport projects, and I think cost benefit analysis in a lot of other sectors as well. So just to say, it's really a challenge to change those tools that we use on the ground, because it's to create a whole new reporting. We've talked, Maliki and I have talked about this. Create a whole new reporting system for traffic injury is a mammoth task. And even modeling it on a small way is a huge task, and there's often not funding for that kind of endeavor. Sorry, Elaine Fletcher from the Department of Public Health and Environment.
I'm happy to say that I agree, and we have the same challenges in many other areas, as you know. So it will be the same for, well, as you know this very well, for energy and air pollution, where the climate change people will count the greenhouse gas emissions, carbon dioxide emissions. We say that those emissions and the things that come with them have big impacts on health, and they do. But in order to quantify the health impacts, you need to also know the particulates and where the humans are exposed to those, and that's not the same thing as just counting how much coal you've burned. So we have many of these challenges that we need to start, yes, getting better indicators of the health impact.
More comments, questions? Please. And please identify yourself.
I'm Laura Vigo. I'm an intern for the Rollback Malaria Partnership. My question is concerning the climate change conference that's going to happen in December. You were mentioning it. I wanted to know if you're going to participate and which kind of strategies do you have, and at which level is the health for this conference? And working for malaria, we work a lot about malaria and climate change and the link between the two, and how, for example, all the insects such as mosquitoes are going to be stronger and stronger and develop more because of all the impacts of climate change. So I wanted to know, like, how far are you with these kind of studies, and if it's going to be presented during the climate change, like the climate conference in Paris.
So the short answer is we will be there. WHO will be there, apparently along with 45,000 other people. It's always a big conference. This one even bigger than usual. So Marina Mayero, who's down the end of the table, is responsible for our engagement with the climate change negotiation process. So the strategy is pretty much always the same strategy, is to try and ensure we basically have three key messages. One is that health needs to be central to the climate change agreement. Two is that the adaptation financial support, all of the support should include health, an appropriate share for health. And the third is that health should be taken into account in the climate change mitigation policies and support mechanisms. I have to say that although I think we are doing better than we used to be, there is more general appreciation now about these links. You see it in the newspapers, you see it in President Obama's positioning. If I had shown the same slide as we showed for Copenhagen, I think it would say almost the same thing this year. Is that right? So we have maybe a couple more side events, and there's slightly more adaptation funding and so on, but still it's the actual operational mechanisms, it's not coming through very strongly yet. But I think with all of the connections that people are making, I think it is the conditions are changing. So we will be in a better position. And then on the malaria connection, it's great that RBM is starting to make these connections. I'm actually a medical entomologist by background. That's where I started in this. And I sort of came into this partly through that sort of controversy that was particularly around malaria. And it was between pointing out that climate change would have an effect on malaria and malaria specialists saying, well, poverty is more important, interventions are more important. Both of those statements are probably true. But they're not actually incompatible. And I think hopefully we've now got to a stage where we have a coherent story that says development and interventions are driving down malaria. That's very good news. Climate change probably makes that harder and presents some increasing risks. And I think that's something that we can get behind and that hopefully the malaria community is also supportive of. So we are talking to your colleagues in the RBM Secretariat, and we'll continue to do so.
We've run out of time, but I'd like to thank the speakers for two wonderful presentations, and I hope your conversations go further and there's more intersectoral work. I'd like to thank all of you for making time to join this event. I'd like to thank our WHO colleagues for all their efforts, and not least the Wellcome Trust for making these conversations possible on a completely independent basis. So thank you very much, and I'd like to thank. And yes, Elaine reminds me that there's a wonderful display just outside, and there'll be special guided tours available to interested parties on the Breathe exhibition. So it's just outside the library. Do you want to add something else? Please do.
Just to say that one of the drivers of public interest in climate change we're finding could potentially be air pollution. People are pretty aware, are becoming more and more aware of air pollution and how it affects their health. And most things that pollute the air also cause climate change. And plus, we also have, besides greenhouse gas emissions, we have the issue of what are called short-lived climate pollutants, including black carbon, which is soot from vehicles, methane, which is regulated by Kyoto, by the, methane is a short-lived climate pollutant, but it's also contributes to air pollution, to ozone. Ozone is also a short-lived climate pollutant, and so it has a climate effect, and it also has a human health effect. So that intersection is an interesting one to generate interest around. And the Breathe exhibit outside is looking at the way artists perceive our changing climate, their kind of extreme reactions sometimes to what they perceive as the extreme environment that we're living in, the vulnerability of people, sensors, very creative uses of air pollution sensors technology to document air pollution and get people's interest, alert people's interest in it. And those who are interested, the group is kind of shrunk now, but if anybody's interested in, we were going to offer a guided tour of the exhibits right after this. So if anybody wants to take a look with us and get a little more explanation from a guide, we can do that right after the presentation. Just be outside the door.
Thank you, Elaine, and thank you, everyone. So, thank you.